Welcome to CareHero podcast, where our mission is to educate, motivate, and inspire nurses and other healthcare professionals. In each episode, we explore how our guests successfully advance their careers and improve the lives of their patients and residents. We share practical tips and success stories to illustrate how you, our care heroes, can grow in your own personal and professional lives.
Welcome, Care Heroes. We're your hosts, Martin Hoy.
And I'm Gerard Hernandez. We've got a special treat for you all today.
Yes, Gerard, we have not one, but two guests on the show.
That's right. A husband and wife power nursing couple. They've got some great learnings to share, including how to get yourself in a position to be chosen for your next promotion, how you can pursue further education at every step of your career, and how to find resources to help you do just that. And we'll even talk about how exciting being on a flight team is and the extraordinary value of hospice care.
All right, let's do this, Gerard.
Hey everybody, we're here with David Damron and Tanya Damron. David is an RN charge nurse and intra-aortic balloon life flight team lead at Intermountain Healthcare's thoracic ICU. And Tanya is assistant director of nursing at Home Health and Hospice for Utah. Welcome to the show. We're so glad to hear from you. So tell us, how did you meet and how did you get into nursing?
Well, the funny story is we actually met in the hospital. We merged hospitals at one time, and I was the charge nurse and Tanya was the unit clerk, and that's how we met.
Was it love at first sight?
No, she actually did not like me. Her correct words I probably couldn't use on the internet right now.
It definitely was not love at first sight, but he grew on me after a while.
So Tanya, I also heard that previously, were you a CNA as well?
I was, yeah. So actually at the hospital we worked at, I was actually night CNA and unit clerk. So I just recently switched to days when David and I actually officially met. I knew of him just in passing, but I met him officially when I switched to day shift.
You worked together for some shifts?
We did.
Did you like working together?
In the beginning, it was a little rough. We definitely have different personalities. I guess that's why they say opposites attract. But like I said, he definitely grew on me, and I obviously grew on him as well.
Yeah, that's great to hear. I mean, that's the start of a very good love story.
All of our care heroes, including yourselves, are superheroes. But if you had to choose one superpower, what would that be and why?
I'm going to go with the power of healing Alzheimer's in specific. A lot of our hospice patients are Alzheimer's, and it is a very sad, slow disease.
You know, I think my superpower would actually be mind reading. I think because of in the ICU, there's so much that is going on with the patients. It can be very, very overwhelming for families and even the patient to understand fully what is going on. There's a resource out there, it's called Dr. Google, that is sometimes not the best information, and they learn from Dr. Google. And if you were able to read their minds, you would be able to help educate them a little bit better on the disease process, anticipated patient outcomes, so the patients and their families have a better understanding of what is to be expected during their hospital stay.
So healing and mind reading for the purposes of providing better care, like quite selfless superpowers that you have both selected here.
At the time that you met, you both had an Associate of Science in Nursing, an ASN. And my understanding is that you both decided to get your bachelor's degree together. Could you tell us a little bit about that?
Yeah, so actually, David had his nursing degree. I just had my CNA degree. And it wasn't until 4 years ago that I actually got my associates in nursing. That was a big push from David, and he was very supportive in that. It's something I've always wanted to do my whole life, but not always do we get the things that we want. So that being said, I was almost in my 40s when I got my RN license. And then they decided that most places were requiring that you get your bachelor's. And I thought, well, I was fresh out of school, about 9 months. So I decided, well, I'm going to get my bachelor's and I told David, I said, guess what? You're going to get your bachelor's too.
That's such a great story. I mean, you were in your mid-career when you decided to pursue your bachelor's degree. Is that right?
Yeah, I'd been a nurse for almost 18 years by the time I went back to school to get my bachelor's degree.
And for many of our listeners, we know that's great advice to hear. It's a great story to hear. So tell us, so what was the thought process in deciding to go back to get your bachelor's?
Well, for me, I'm in a leadership position at my hospital, and they actually require a bachelor's degree. But because I had been working with them for so many years, I was kind of grandfathered in. But with Tanya going back and getting her bachelor's, I figured now's a good time to go and get mine.
And Tanya, how about for you? What was the thought process to getting a bachelor's degree?
Well, I figured that it had taken me this long to get my nursing degree. And like most people can probably contest to, the longer you wait to further your education, the harder it is. So I just decided to move forward with it. I had actually done a accelerated program. So I got my associates in nursing in 18 months and I got my bachelor's in 9 months. So I did my degree in a very short amount of time.
Well, one, like going to school with your significant other, like how did you both manage to do that, especially while working, presumably at the same time?
You know, it was actually really good to go to school together because there were classes that I had strengths in, and then there were classes that Tanya had strengths in, and we were able to help each other out, better understand the classes and what is being lectured to.
Do you have any other advice for our listeners who may be thinking about taking the plunge?
Do it. Just do it. You know, for me, because it was 18 years later, I was really hesitant, very reluctant to even want to go back to school because for years I didn't need to. But once it was done, it was over. It was a relief that was lifted off my shoulders. Just if you want your bachelor's degree, go for it. If you want your advanced practice degrees, go for it.
And we get that a lot, or at least we've, in hearing that, yes, this education is really going to be something that's going to open up more opportunities. Clearly here in for you both, it was necessary to have further advancements even in your careers at your own hospital and of course at home health and hospice for Utah.
Absolutely. With your nursing degree and your bachelor's, you can pretty much go anywhere and get a job.
And we know now, pandemic-proof career.
Yes, it is.
Oh, definitely. We have definitely had job security.
How did you approach your workplace to tell them that you wanted to go back to school?
Well, my hospital, they actually have a tuition reimbursement program. So they actually reimburse me up to a certain percentage of my tuition to go to school. It was basically, I just filled out a couple pieces of paper, submitted them, and then I committed to working to them for X amount of years or X amount of time after that.
Perfect.
A lot of hospitals, a lot of big hospitals will have some type of education reimbursement to further their education of their employees.
Which I think is very beneficial because, I mean, most people can't afford to go to school, let alone go back to school. So I think it really gives them the encouragement that they need, knowing that they're not going to have to front the entire cost.
It is good that you took advantage of that because I see a lot of employees are not really looking also into the full benefits and maximizing what it is their hospitals or the hospital systems offer. So that's terrific that you both did that. So
could you tell us, maybe take a second to each talk about each of your roles and what you do at your facility?
Well, I'm the Assistant Director of Nursing for Home Health and Hospice for Utah. I have worked there for a little over 2.5 years. I started out just as a case manager, managing my own patients, and I was able to work my way up to the position that I'm in now.
Could you tell us a little bit about what steps you took to be able to get that promotion?
Yes, I was a team player and I was able to just show that I was a reliable, hard worker, and administration had saw that. And when the position came available, I applied for it and interviewed and luckily was offered the position.
And David, could you tell us a little bit about your work and what you do?
For most of my career, I've been in the critical care, intensive care field. Where I currently work, I worked my way up so I started out as a floor nurse, worked up to a charge nurse.
Can you explain to our listeners what the life flight aspect is of your role?
Yeah, so with the Life Flight operates like a trauma team that goes out to scene flights. They also have a transport team that actually does specific cardiovascular patients. With my transports, my patients have to have a balloon pump in or what is called an ECMO machine, which is a heart-lung bypass machine that is placed in at other facilities. And we will go out to their facilities, pick up the patient, and then transport them back to our hospital for further care. So it's basically a medical life flight transport team for critical care patients. Intermountain has several other facilities around, but when those devices go into the patient, they actually are transported to Intermountain Medical Center for further care.
And I'd be interested to know, you started on the floor as an RN, you moved your way up as charge nurse, and now you're a team lead. What are some things that sort of got you to where you are today? Could you impart some of your knowledge?
Basically, a lot of hard work, a lot of education. If you're not learning, you're not bettering yourself. And if you're not bettering yourself, you're not going to be better to help take care of these patients. One of the biggest things that I can always say is if you make a mistake, it's not the end of your career. It's not the end of your life, whatever. Learn from those mistakes, improve yourselves, and just keep learning so that you can better yourself to better take care of these patients.
That makes sense. And how did you get chosen?
I actually got just nominated from my manager. The team lead before that wasn't fulfilling his requirements. And so there was a meeting with my nurse manager, another nurse manager, and the life flight manager. And my nurse manager said, "This is David. He is now the new balloon team lead," because my manager felt that I was competent enough to be in charge of this team after I'd been on the team for about 7 months.
So you were in a position to get that role in part because of the work that you'd done and you'd shown that leadership to your superiors.
One thing is be assertive. If you are in the unit, yes, you need to take care of your patients. But when these sick patients come out of the ORs or come in from a life flight transport team, go in, help out the nurses that are in there, ask questions. What is this device? What is the purpose of it? How do I take care of it? Just put yourself in situations to learn from those nurses that have had that experience. And that's kind of what I did, is I was always wanting to help. So I kind of put myself in those rooms to learn from other nurses that had by far more experience than me, so that I can learn how to put myself in better places to set myself up for success.
So Tanya, especially between you and David, actually, you cover quite a bit of the continuum of care here. With critical patients, of course, with David, but Tanya with home health and hospice. I think you're really seeing something that's like part of a huge industry shift here, which is patients getting pushed to a lower level of care. So I'm really curious to hear, how have you seen that impact your work?
Well, ideally, the goal for any patient is to keep them out of the hospital. Our focus, especially in our home health, is to educate them and give them what they need to live a healthier life to avoid repeatedly going to the hospital. Hospice, on the other end, it's our goal is to increase quality of life of what life they have left. So unfortunately, it's sad, but for us hospice nurses, it's actually gratifying that we are able to help these patients and these families to live their best days, of their rest of their life, and that's okay. A lot of people don't understand the word hospice. They think that hospice is, you're going to die in the next couple days, but that's not what hospice is. We have patients who've been on hospice for 9 months, a year, but it allows them to not have to be in the hospital and to be at home with their family. which I think most of us would want.
What you're doing is very important. So could you describe a little bit about how you chose to go into that field?
Yeah, I sure can. I'll be honest, if you asked me at the beginning of my nursing career if I would, ever do home health and hospice, my answer would have been no. I wanted to be just like David when I grew up, and I wanted to work in the ICU and take care of the critically ill. However, when I was in the hospital, I found that the care that I was able to provide to the patients that we could no longer save, in a sense, we were out of options on what we could do. I found that I was very empathetic and sympathetic, and I loved taking care of those patients. And so that's what helped me to transition to the home health and hospice side.
It's great how everyone eventually finds their place in the healthcare system. Could you tell us what a typical day looks like for you?
Whether it's in the hospital on the floor or out in the field taking care of, in the community taking care of patients. So the biggest part of my day is basically coordination of care with, our patients. I communicate with all of my nurses and CNAs and helping them provide the best care for all of our patients. So, I do have, back office stuff like most administration does. I'll put it this way. I wear my scrubs to work every day. That way, if they need me, I'm ready to go.
It's a good way to put it. And David, could you tell us a little bit about your typical day?
So when I go to work, it's taking care of these patients, assessing them, administering medications, talking to medical providers about continuum of care, getting orders for them, just kind of helping them get through that 12-hour shift, whether that's medications, assessments, further procedures, diagnostic testing. I'll take patients downstairs if we need to for assessments, and just a lot of observation and just kind of following their vital signs and monitoring them. If I'm a charge nurse that day, then I will actually kind of walk around the unit. I will go in, assess the patients, help them out with the nurses, kind of assist the nurses with whatever needs that they have, and just kind of be there to be support to staff.
Could you describe the best way to work and communicate with management?
Be open and honest with them. Most people look at management as they don't care and, they just have office jobs. That's not true. If you're open and honest with them, they really respect you for that. And it just keeps that open communication. They can come to you. And if you can accept criticism and learn from it, that's huge.
I agree with Tanya. You have to be able to not just look at them as your manager, your leader, but you have to look at them also as your colleague. You have to be able to talk to them, be open with them. If they make suggestions and you don't see that it's a good one, or not necessarily a good one, but an appropriate decision, talk to them. Be able to talk to your manager and say, what, I agree with change, but I don't know if this is the right way. Be able to offer them suggestions as well, too, because they might not see things that we see out on the floor as well with them. Give them feedback as well, too, because they might see something from their perspective. But if you can enlighten them on your perspective, things can work out. They get a better understanding of how things are going.
That two-way communication is important. And I'm sure that they value you more in your role if you can provide helpful feedback, because they're, like you said, not on the floor.
Yeah, absolutely. You have to be able to give the feedback to them as well, too.
To our listeners here, what's your best piece of advice that you could give them?
Never give up. Nursing is not the easiest out there. It is very beneficial. It's very rewarding, but we are all human. We are going to make mistakes. Some mistakes are small. Some mistakes are career ending. If you choose to do that, learn from them. Just keep moving forward. Learn from your mistakes. Be assertive. Put yourself out there. Continue to learn.
Yeah, the biggest for me is teamwork. It's not just you out there, it is multiple people, and you need a team to work well together in order to provide excellent care to these patients and to be supportive and a resource for your fellow peers. And as David said, our biggest motto, not just in nursing, but in life, is to keep moving forward.
Great words to live by. And say you get to travel to the future. What does the future of nursing look like to both of you?
Well, I think in my field, I think that I can see it heading toward more off-site management with the invention of telecritical care, telehealth, that telehealth medicine. Like nursing ratios right now in the ICUs are 1-to-1, 1-to-2 patients. I think with having an outside help, those ratios can go to 1-to-3.
There's going to be a lot more people in their senior age, elder years. And so hospice there may be a greater need for hospice in the future. Do you think that we're sort of well positioned to handle that?
No, I don't.
What can we do in your view to improve on our current trajectory?
To help people out with this question is, even me, that I've been a nurse for years, hospice is still confusing to me. Even though that Tanya works in that field, hospice I've always associated with, I'm going to go on hospice, I'm going to die. That is not the case. Educating healthcare providers, nurses, CNAs, that hospice doesn't mean it is end of life, but it doesn't mean that you're going to die tomorrow. It's you're going out, you're providing for these patients, you're establishing a relationship with these patients and helping them live the best quality of life. So for a nurse like me that's been a nurse for years, I didn't understand what hospice is. I just figured the patients were going to go home, they were going to die. But hospice is actually going in and providing care for these patients and their family to live the best quality of life. And I think that there's a misunderstanding of actually what hospice does. So I think if hospice has a better education to it of what it actually entails, I think more people would be interested in the idea of hospice as a medical provider or a nurse, a CNA.
That's great. And actually, speaking to that, because we do have listeners out there that could be interested in trying to decide what their careers are. And like Tanya, so my background is skilled nursing facilities, actually. So which gets confused a lot of times with hospice. Do we have hospice beds, or are they the same thing as a SNF bed? So if someone wanted to get into potentially hospice nursing, how do you think they could go about doing that or learning more about it?
Just reach out. Most hospice companies have lots of informative information on their websites to learn, what hospice is all about. But we love it when people just call us up and say, hey, I'm just calling you because I just want to know what hospice is all about. And we love to educate. So, to answer your question, I didn't understand it either. So before I became a hospice nurse, I did my research. I reached out to someone that I knew who worked in that field to better understand what hospice is.
Oh, that's fantastic. Yeah, I think networking is something that we'll have to definitely encourage people to go out and do.
David, Tanya, do you have anything else to say to our care heroes today?
You guys are all amazing. I think during this pandemic especially, we get up every morning, we go to work, we do our jobs, we come home. I think everyone in the medical profession is amazing right now. They are really stepping up to the plate and putting themselves out there in very vulnerable situations that the outcomes aren't good, but we're out there doing it. And I think everybody out there is absolutely amazing.
And I just feel that everyone has come together to provide the best care they can with very little understanding of this virus. And you're all making a huge difference in the world.
What an inspiring episode, Martin. Now it's time for the handover.
All right, folks, here are our top takeaways from this episode. The longer you wait to further education, the harder it is. Just do it, even if you've been working for years. Once it's done, it's a relief off your shoulders. Many hospitals have programs that help you further your career and help you cover tuition. Take advantage of them. Work hard, make yourself known as a top performer, and don't be afraid to tell your managers your view on things. That will help you get noticed for your next promotion. If you want to learn about working in a particular part of the healthcare system, just pick up the phone and call. You may be surprised at how open and willing people are about talking about their roles. And finally, be assertive and honest. Ask questions, and don't be afraid to learn from those with more experience. Be able to accept criticism and learn from it.
Great handover, Martin. We want to thank our Care Heroes for listening, and don't forget to rate our podcast on your favorite podcast app. And if you want a shout out on a future episode, visit careheropodcast.com. On the Contact Us page, send us your name, role, and location for a shout out on a future episode.
That's right, Gerard. Now it's time for some shout outs.
Yes, we want to give a shout out to Anna Lynn, registered nurse from Los Angeles, California, Jen, registered nurse from Salt Lake City, Utah, and Mark, an MD from New York City. All right, that's it, folks. We'll be back soon. Same Care Hero time, same Care Hero channel.
Thanks for listening to CareHero Podcast. Don't miss out on future content. Hit subscribe and rate us in your favorite podcast app. Also, remember to visit us at careheropodcast.com to send us your feedback, sign up for the newsletter, and nominate a Care Hero to be interviewed on a future episode.